we are going to officially move on to the best part of the night, which is getting to hear from Dr. Sally DeNotta. And she's going to go over lots of different health items with the horses, including vaccines and some myth busting. So the more questions you can ask her and the more interactive that you can be, the better it's going to feel as a group. So feel free to ask questions, type in the chat, or yeah, communicate with Miss Sally. She'll take care of you. All righty, you're up.
Okay, everybody, thank you so much for being here tonight. Thank you so much for inviting me to come chat. Can everybody hear me okay?
Yes.
Nods. Okay, good. So hearing the thank you. Hearing the 4-H pledge brought back a lot of really good memories for me. I grew up in a very small town in a very rural area on the Oregon coast, so on the total opposite corner of the country, and I was very involved in 4-H. Growing up, I had a quarter horse named Fancy, who next month will be 30 years old, if you can believe it. So I actually bought her when she was 3 years old, and I took her to the local county fair all through middle school and high school, and I participated in horse judging and hippology, and those were some of my best memories. So take advantage of them now. It's a really great way to be involved in horses. And now I'm a veterinarian because I loved horses so much growing up. I really wanted to make sure that I had a career where I got to essentially work with and play with horses every day. And so now I work at the University of Florida, and I am a doctor in their hospital. I take care of sick horses with specific, in my most favorite patients are the sick foals. So I love babies, and so it's getting to be spring baby season right now. So I've had a few sick babies in the hospital lately, but we also see goats and cows and other smaller farm animals like pet pigs occasionally, but mostly horses are where all my history and certainly where my love is. So I'm going to share my screen. I have a little talk today about horse health myths. So these are things that you may have heard about or talked about in your group, or you may hear at the local horse show or in out of the barn. And some of these are really common myths that you can now have a little bit better information about and be the bearer of the facts about horse health care. There's some important ones. This is much more fun for everybody, including me, if we're interactive. So please feel free to have your camera on. Please feel free to interrupt me and ask questions. We can, Miss Kelsey is going to help if you want to raise your hand. And if I don't see it, she can help interrupt so that I can answer your questions. And then if Miss Kelsey could keep an eye on the chat too, because it's hard to do the PowerPoint and read at the same time. So you guys just go ahead and throw in questions and comments, and we'll go for maybe 30 minutes or so. And then want you guys to be able to answer some questions or ask some questions. And even though meeting virtually is maybe doesn't seem as fun at first as it would be if we were all together, there are some fun things about doing virtual meetings with youth groups, of which I do a lot in this past year. And that's, I can take you guys backstage, if you will, at the vet school and actually let you tour through some of the surgical suites and some of the areas that we usually can't take students with. So I have another group meeting with you guys, I think next month. I'm hoping Miss Kelsey will remind me when we're meeting again. And if you guys are interested, we could perhaps do a vet school tour and a backstage tour. I heard a couple people already say they wanted to be veterinarians one day. So that's always kind of a fun thing. Meet a few of the patients, maybe meet a few of the vet students. Okay, so let's go ahead and get started. Let's see. Hang with me just a minute. Let me get my display going. Okay, can everybody see that in display mode? Okay, great. Okay, so let's just get started right off the bat. What's the first myth that I wanted to talk about tonight? All veterinarians perform medical care on animals. What do you think? True or false? Somebody shout it out.
We have true in the chat.
True. You would think so. So turns out it's false. Not all veterinarians work on animals. We all get training to work on animals, and we go to medical school for animals. But once we get out of school, there's a huge industry for veterinarians, and there's many different facets of the career as a vet. And so there's, believe it or not, 75,000 veterinarians just in this country alone. So lots of vets out there. And while many of them do clinical jobs like me, where we work on large animals or small animals or cats and dogs or even exotics, some veterinarians work in government. So they help to create laws that govern how we use animals in this country, how we use animals as pets, how we use them in the food chain, how we transport them, various animal welfare laws that we have in place. There's regulatory veterinarians. Their jobs are to actually work with animal owners to help keep disease out of this country. There's diseases that affect animals in other countries that we really want to try to keep out of this country. And there's diseases we have in the US that other countries don't really have, like, say, for instance, rabies is here in the USA. That's a virus, and Australia has no rabies. So they work pretty hard through regulatory veterinarians to keep that virus out of their country. And then there's military veterinarians too. And so these vets work for within the military services. This is usually the Army, but I believe you can be a vet in many of the different branches. And you might work in regulatory work there, or you might work on things like service dogs, like military service dogs, which would be pretty darn cool, stiffing dogs and dogs that go to war. And then there's veterinarians that work in academia, which is in the universities and in research. And so they may not work on pets or owned animals, but they might do research about diseases and healthcare that helps not only animal patients, but human patients too. So there's really a huge range of things you can do as a veterinarian. And then there's the vets that you more commonly think of. And these are the vets that help keep animals healthy. And that's what I like to do. That's what most vets are, but not all. And there's companion animal practice, and those are like pretty much dogs and cats. So that's probably the most common kind of vet. And there's equine practice, which of course is what I like to do. And then all sorts of different specialty practice. So exotics, they work on things like this iguana right here on the right, or birds or turtles, or if you have pocket pets, those can all go to an exotics animal veterinarian. Production veterinarians work on animals that are in the food chain or in the like the dairy industry. And then there's wildlife and zoo. They have a really hard job because their animals aren't halter broke. They're totally wild. So that represents a whole hurdle. Lots of different kinds of vets. This is where I mentioned that I work. This is the University of Florida. This is in Gainesville. I'd love you guys to come visit someday and take a tour. When I'm not in the hospital, I am an extension veterinarian. And so I get to take youth groups through the vet school and do talks on how to become a veterinarian and introduce you to the hospital and vet students and answer all the questions that you might have. And so in the immediate future, like I said, hopefully if we meet next month, I can take you on the road for a backstage tour with my phone and Zoom. And it's been great fun. So although horses are my favorite, we deal with, and they call me technically a large animal vet. You can see some of my patients are not very large at all. This was a goat kid that was about an hour old. So we deliver lots of little goat kids. They're great fun and they're quite little. Okay, this is probably maybe the most important myth of the whole night. And I hear this all the time right now, especially after last year where you guys probably experienced that healthcare for you was a little bit weird. Healthcare for your horses may have been different and weird. So veterinarians weren't working. They weren't able to go to the barns the same way that they could years before. And so some of veterinary care last year during all the shutdowns was just emergencies only. And as a result, a lot of the horses last year didn't get vaccinated the way that they normally would. And you probably learned through 4-H and through your hippology courses on how important vaccines are. And so a common myth that I hear is this: my horses haven't left the property all year, so it's probably safe to skip vaccines until next spring. Who wants to be brave and say whether they think that that is true or not true?
So far, we have many in the chat saying false, and Emma
Excellent. I knew you guys were smart.
actually said that bugs carry bad stuff.
Audrey.
False, because you never know what can get inside your property and contact your animals.
Yes, yes, exactly, Audrey. Okay, so here's the deal. All horses, no matter whether they travel, no matter how old they are, no matter if they're showing or not showing, if you have one horse that sits in your backyard or if you have 100 horses on a boarding stable, they are all at risk for what we call the 5 core diseases. So there's lots of diseases horses can get, but there are these 5, and they are special because you cannot prevent them by keeping your horse in a bubble in your backyard or not showing like you can some of the other diseases. And so these 5 diseases are Eastern equine encephalomyelitis, which is a mouthful. So we just call it triple E, EEE, pretty easy. Rabies, that's a really bad one, right? That's a virus. Then there's Western equine encephalomyelitis, which we shorten to WEE. Tetanus, which you guys have probably heard of because people can get tetanus, and then West Nile virus. And what makes these 5 diseases so special is that they are carried into your environment or into your horse's environment by things that you, even no matter how good of a horse owner you are, cannot avoid. So does anybody want to throw out any guesses? How do these diseases get to your horse? Who carries these? Some of them.
I have a question.
I think I heard mosquitoes.
Yes.
Yes. Perfect. Okay. So here's my little, here
I have
are
a
the
question.
3 bad. Yep. Go ahead.
So if your horse is vaccinated and it's around other horses that are not vaccinated, is it still likely to get the disease?
Oh, that's a great question. If your horse is vaccinated, then your horse should be protected.
Okay.
Now, that's not vaccinated could get it from another horse and they could pass it on. But your horse, now with that said, not any vaccine, there's no such thing as a vaccine that's 100% effective. But we know that they prevent most diseases most of the time. And they may, even if your horse did get exposed by that unvaccinated horse, if your horse is vaccinated properly, the severity of the disease that your horse gets is usually far less than if it wasn't vaccinated. So we call that protection or partial protection.
Yeah, my horse is vaccinated, so.
Oh, good girl. Excellent. Okay, so these 5 core diseases are carried to your horse by, I heard, mosquitoes. And here in Florida, that's the big one, right? Because we're like the mosquito capital of the universe, I'm pretty sure. So we have triple E, which people can get, Western or WEE, and then West Nile. People can get this too. Now, people don't get these from horses. They get them from mosquitoes the same way that horses get it from mosquitoes. So unless you have some way of making sure your horse never gets bitten by a mosquito, which PS, if you figure that out, please let me know. Then your horse needs to be vaccinated because these are bad viruses that you don't want to get yourself and you don't want your horse to get. Rabies is 100% fatal. So this is very rare, luckily, but it is bad if they get it. And horses that have rabies can give rabies to people, and it's fatal in people too. So even though this is very rare, we worry about rabies because it's such a serious disease. Now it is given to your animal through your horse through a bite from infected wildlife. So things like raccoons, skunks, bats are known to become infected with rabies and then bite horses as a method for spreading it to them. So we definitely want to be protected from rabies, right? Tetanus is in dirt. So that's what this little picture here is. This is a pile of dirt. Tetanus is a bacteria. It's a Clostridia bacteria. And if you went out, if you had a little bacterial molecular identifier, if there was such a thing, if you went out right now in your backyard or your barn or the bottoms of your shoes or anywhere, you'd find tetanus all over the place. Tetanus bacteria lives in the environment and it gains access to us through a wound, which is why if you step on a nail, you go to the emergency room and they're going to give you a tetanus booster. Same thing with horses. So they get it through wounds or scratches. And so unless you can keep your horse from ever touching any dirt, which I've seen a few show horses that sort of qualify for that, but no dirt at all, then your horse needs to be vaccinated for tetanus, okay? So these are the 5 ones that no matter who, where, what, or why, your horse needs them. Now, there are some other diseases called the risk-based diseases, and those are things like flu and herpes. They're also important diseases that you hear a lot about. Those are the ones that you and your veterinarian can decide, is this right for my horse or is it not right for my horse? And it might be different if you have a young horse that you're showing, taking to fair, taking around to gatherings versus like my 30-year-old mare that doesn't see anybody, doesn't go anywhere and just hangs out. So it can be a little different for the risk-based. Okay, it looks like I've got maybe some questions. Who wants to ask? Anybody have questions?
There was a question of, do possums carry diseases harmful for horses?
Yes, you're probably thinking of EPM. EPM is carried by possums. It is not a virus. It is a protozoa, which is a parasite. And we do not have a vaccine for EPM, unfortunately, but it is here in Florida. It causes neurologic disease and it's carried by possums. So yeah, possums are not your horse's friend. Okay, all right. So the next myth, colic, and especially colic surgery, is a death sentence for horses. So what do you guys think of this? Does anybody know a horse that's had colic and survived, or do they all? Is it bad news?
Lots of false in the chat.
False, excellent. Okay, perfect. And what is colic? Let's start there for you hippology majors. Anybody want to tell me what colic is? Audrey, go for it.
Colic is when their guts get twisted up. When they sometimes try and eat, it might go down the wrong tube or something like that. So they roll on their back and kick, but they don't know that it just gets their guts more twisted up.
That is, yep, that is a common theory on colic. And yes, their guts or their intestines can twist, which is weird about horses, right? I'm glad our guts don't twist, but horses can.
Actually had that happen.
Are there other kinds of colic maybe that don't include twisted intestines?
Impaction that has various causes.
Yeah, impaction, exactly. Impactions can cause colic. That's pretty common.
Gas and dehydration.
Yes, gas. And so what I'm hearing from the crowd is there's lots of different reasons for colic, and that's exactly true. Colic is just a horse word. We like to make special words for horses if you haven't noticed, because it's good for hippology. Colic means stomach ache, means belly ache. So it's the same thing as just saying they have pain somewhere in their abdomen, okay? And there's lots of different kinds, as you guys have already alluded to. So there's lots of different causes, which means, not surprisingly, there's lots of different outcomes. Some colic is very severe, some needs hospitalization and surgery, some respond with no treatment at all or very minimal treatment. The good thing to know is that most cases are mild and actually resolve on the farm with little or no treatment, or maybe with a vet visit and some basic care. So what I want you guys to walk away with is, if you hear somebody talking about colic and they say, oh my gosh, my horse had a bad colic episode, maybe my horse had to go to the hospital, maybe my horse didn't make it. Colic is a death sentence, and it's not, it's very serious. There's no doubt. But it doesn't mean that horses can't recover, because they can. And the good example, I think, of this, or the metaphor that I use, is people get belly aches all the time. And it can be maybe because you ate a little bit too much ice cream after dinner, if you're like me, and you have a hard time stopping eating ice cream once you get started. And I get a bellyache and I don't need to go to the hospital because I know what I did. I ate way too much ice cream. So you just need to sit down and watch Netflix and just wait for yourself to recover a little bit. Horses are the same. It can be very minor. Or if you have a bellyache, maybe you have appendicitis and you need to go to the hospital and actually have your appendix surgically removed. So lots of different spectrums, all for pain in your abdomen. Same thing with horses. So with that said, this is why it's serious. Colic is the #1 killer of horses, short of horses that just pass away from old age. But most cases are mild and most resolve with simple medical treatments. And it's not a disease in itself, it's a symptom. So it's the sign of a bellyache, okay? And it can come from lots of different causes: sand, dehydration, twisted guts, all the things that you guys mentioned. And here's how to know that your horse is colicking. Audrey already alluded to some of these, but mild colic, your horse might start to paw a little bit. That's usually a sign of pain somewhere. Might stretch out. Flank watching is where they actually turn around and look at their belly, sort of like, hey, that's where it hurts. Maybe if I look at it, it'll fix it. They might stop eating, so we call that anorexia. They might lie down more than normal or have decreased manure production, particularly if they have an impaction. That's better than the more severe colicking horses, where they might actually get down and roll like this guy here, might thrash around in the stall. They can cause abrasions or wounds actually to their face from thrashing around, knocking their head on the wall. And then they might have abnormal gum color. So see this really bright red, we call these brick red mucous membranes. This is an indicator that your horse is very sick. So you guys that have horses probably see nice light pink mucous membranes, and you don't ever want them to look bright red like this. Okay, lots of things cause colic. We've talked about that. Here's the most common ones, and you guys already told me all these, so this is just a review. Gas, or what we call spasmodic colic, that just usually resolves on its own. Dehydration from travel or from stress can cause some horses to have some colic, and then impaction can happen sometimes when they stop drinking. Maybe it's too hot and they drink all the water and the water buckets don't get refilled, or up north right now where it's quite frozen, sometimes water buckets freeze over, and that can cause impaction colics because they can't drink water to help increase the fluid content of the food they're eating. Okay, but 90% of colics luckily can be treated on the farm. This is a horse in the hospital. You see he has an IV catheter. He has a tube. This goes down his nose so we can give him fluids, but he's uncomfortable. He's colicking, and you can see that he's pawing the ground. I heard somebody say sand, and this is how we diagnose a sand colic here in Florida, where we have lots of sand, and they eat it accidentally usually as part of eating on the ground and trying to pick up scraps. We can take an x-ray of the horse's abdomen, of their belly area, and where you usually think of x-rays as helpful for bones and looking for broken bones or orthopedic problems, it can be actually pretty helpful for finding sand. And so this is the bottom of the horse's belly. The horse is facing the right of the screen, so this is actually the flank region here. And here you can see in the bottom of the colon, all this white accumulation. That's like a beach, that's sand. So if we found this on an x-ray of a horse that was colicking, we'd say, okay, we know what's going on. He's got sand in his intestines, and we have treatments that help clear that. The other thing that Florida horses can have are something we call enteroliths. So here's another image of an abdomen. You see there's ribs here, these big, long, streaky bones. And then at the bottom of the abdomen, you see instead of kind of that white, sandy, sort of homogeneous looking blob, we've got little round, discrete structures, and we're even measuring them here. And when this horse went to surgery, his intestines were full of rocks. These are from that horse. And so these are called enteroliths. These are stones that form in the intestine slowly over time. And this happens in Florida and California, places that have both sand and lots of calcium in the water. Okay. So let's talk about colic surgery because it's pretty scary for anybody, for all horse owners. The good thing is that horses survive colic surgery at a higher rate than ever before in history. We have great surgeons, we have good operating rooms, and people are getting their horses to the hospital sooner than ever. And so these are the survival rates that we have here in our hospital, and this is the similar that you would find to places, the big hospitals in Ocala or throughout Florida or South Florida. And so you can see 88% of surgeries on the small intestine, that's a certain part of the GI tract, 90% or more survival for large colon colic. So that's pretty darn good. It's not perfect, but it's pretty darn good. And most return to their previous level of competition. And a great example of that, this was a patient of mine, a 3-day eventer in New York, and he had 2 colic surgeries. And this was him 1 year after those 2 colic surgeries. So they can recover and go back to work.
What does this kind of surgery cost generally?
Yeah, that's a great question. That's the hardest part about colic surgery, I think. So the colic surgeries generally can cost from $6,000 to $10,000. So they're expensive. They're a lot more than my first horse cost, I can tell you that. But more and more horses have medical insurance these days. So we see horses that come in that have coverage either through insurance companies or through, if any of you use like Smart Pack products, they have a colic care, colic surgery program that I think can be quite helpful. And then there are different options for financing it or saving up. And some people have savings that they keep specifically for healthcare emergencies for their horses. But it is a lot of money.
And I will say that a lot of people think the insurance is only for your top end show horses, but most insurances have options for your daily driver horses and your backyard friends. They're not always the show horses. And I know even with my guy, he's 17 going on 18, and he's not a show horse, but I still have insurance on him, and it doesn't cost that much. So it's something definitely worth talking with your veterinarian about, or even just your parents, and figure out, is this something that we can do? Because most of the time when we have to make those really hard decisions, money is a factor. And if that's something that you can put aside and say, we got this, it's amazing what you can do.
That's so true. That's a really good point. Colic often happens in the middle of the night and you're stressed and you're worried about your horse because you love them. And having to make that kind of a decision in those conditions can be really, really tough. And so, and like Ms. Kelsey said, the horses that are backyard horses that aren't the really, really expensive show horses, their insurance policies aren't as expensive, but they have just this good of coverage. So they'll still cover a colic surgery or whatever health care your horse needs. And it's certainly something to look into. Usually you pay a little bit each month to have that kind of insurance. My dog has health insurance, believe it or not. And I'm a vet, I can do a lot of the work, but if you've ever had a dog get hit by a car or have to have a major surgery or a knee surgery, it's really expensive. So even me as a vet, I pay a little bit every month, and my dog has health insurance. So it's getting more and more common, and I would expect it to be more and more common. Okay, this one's kind of for fun. Do you guys know who Secretariat was?
Yes, ma'am.
Yes, perfect. Okay, so he was a really famous racehorse in the 70s, before all of our time. And he won the Triple Crown. He was a great big red chestnut horse, and he won the Triple Crown. Do you guys remember which races are in the Triple Crown? Anybody want to shout them out?
Kentucky Derby, Preakness, Belmont.
Yeah, good job. Excellent. I was thinking about that earlier when I think it was Emma was talking about her horse Hansel, and his sire, Union Rags, won the Belmont in, I don't actually remember which year, but he won the Belmont. So that's a big race. He's got a famous daddy. So Secretariat was a famous racehorse. It broke tons and tons of records, won the Triple Crown by like the biggest margins you've ever seen. If you ever want to watch an exciting horse race, YouTube the Belmont Stakes when Secretariat won it. It is just absolutely amazing. But they always said that he won because he had a lot of heart, because he actually didn't pass his racing ability on to his progeny. His babies weren't very fast. So they thought, well, he must just have had a lot of heart, like a lot of courageous, athletic heart. But it turns out he actually had a giant heart, like his heart. So the average thoroughbred heart weighs around 8 or 9 pounds, which is pretty big, right? When Secretariat died I think he was well into his 20s, they did an autopsy on him and he had a 22-pound heart, if you can believe it, which is kind of cool. So this is him. He had this really neat blue and white checked racing mask that he raced in. Okay, here's another myth. This is a common one. Rolling causes colic. I'm going to look in the chat for this one. What do you think?
So far, everyone in the chat says false.
False. Oh, you guys are so smart. Okay. So I get told this all the time by owners. They bring their horse in and is colicking. And so they bring it into the hospital and they're like, oh, shoot, doc, I'm so sorry. I caused this. I let my horse roll and it twisted his guts up. And I always say to them, or any group like this, how many of you guys have a horse that you saw rolling in the last week? And everybody raises their hands. How many of your horses have colicked in the last week? And hopefully, fingers crossed, nobody raises their hand. So horses roll all the time. This is false, okay? They love to roll, right? They love to roll, especially when my horse loves to roll when I give him a bath. First thing he goes out and does is get as dirty as possible. The link between rolling and colic is actually flipped. They don't colic because they roll because they're colicky, if that makes sense. So they have a bellyache. They don't know what to do. They're not like us where they can talk it out, sit down on the couch, take a Tylenol. And so the only thing they know to do is to try to move around and get on the ground and try to roll around. And I don't know, maybe there's an evolutionary behavior here that we just haven't really figured out yet, that they're trying to get their GI tract back into place or pass some of that gas that's stuck, that's causing the problem. I don't know why they developed this behavior. I don't know anybody does right now, but the point is, don't beat up on yourself if your horse colics. It's not always something that you can prevent. In fact, most of the time, I'd say it's not something you can prevent. But don't be worried that rolling is going to make the colic worse. They're just rolling because they don't feel well. With that said, what I do always say that I think is important is if your horse is colicking and he's rolling, don't get in his way. Don't get hurt because they're not paying attention to you when their belly really hurts, especially if it's severe. And so what you don't want to have is your horse in the trailer on the way to the hospital and you in the car on the way to the human hospital because you got kicked by a rolling horse. So always be safe. All right. Here's another myth, and this will go back to a little bit of what we already talked about, but there's no way to prepare for sudden colic. What do you think? So this is sort of true, sort of false. There's probably no way to prevent all types of colic, but you can be prepared for how to handle it if your horse does colic, okay? So step one to that is to have an emergency plan. Make sure that you're not trying to figure out how to trailer your horse to a hospital or how to get a hold of a vet. if you don't have a vet, when your horse is colicking and it's 2 in the morning, because that's going to not be, that is going to be really difficult. And then also, the most important part of knowing that your horse is having a crisis or that something's wrong, you have to know what your horse is like normally, right? And so if you're going to be able to assess your horse, learn how to do a good physical exam, and there's lots of YouTube videos out, know what your horse's normals are, okay? So here's the normal, what we call vital parameters. And the vital parameters are temperature, heartbeat, and respiratory rate. And you can take these with a simple thermometer. You can feel their pulses, usually either by putting your hand or your fingers on the side of their face right here. They have a little artery you can feel. Or I recommend that horse owners own a stethoscope, and you can buy one at CVS or Walgreens or Amazon for like 10 bucks. They're not expensive, and they will allow you to listen to your horse's heart. And you can watch your watch or time it with your phone and see how many heartbeats per minute. And horses that are in pain, their heart rate will go up. Respiratory rate, you can just watch their sides of their chest go in and out as they breathe, and you count how many breaths they take in a minute. And then nice pink gums. Remember what those brick red gums look like compared to these. These are nice, healthy gums, nice teeth. So this is a healthy horse. And then horses usually make 6 to 10 piles of normal, well-formed manure every 24 hours. Now, if your horse is out in a pasture, that's kind of hard to count, right? But if he's in the stall, that's a little easier to keep an eye on. But these are the kinds of things you want to know for general horse health. The temperature one is really important because this is different than humans, right? So if your horse looks a little different, you think maybe he's colicky, maybe he's not quite right, he didn't eat his dinner, I'm going to take his temperature. Well, if you didn't know that a horse's temperature can normally go up to 1015, if you're comparing it to humans, what's the normal temperature for a human? Who knows?
98.5.
Yeah, exactly. 95, 98.6, around 98. That's not even in the normal range for a horse. So if you're thinking horses must be just like humans and they're about 98.5, and you go out and your horse is 101, you're going to be like, "Bah!" But that's actually totally normal for a horse. Okay. Now it's good to know what your horse is normally. And I usually say for people to take their horse's temp at the same time, either in the morning or in the evening, every day for like 3 or 4 days in a row, because a lot of horses will stay right around one temp. Like some horses like to be 99, some horses like to be 100. And in those horses, if your horse every day is 99 degrees, then maybe 1015 is too high for him. But you have to kind of have known what he was like when he was normal to know that. And then the second part, go ahead.
Sorry, there was a question in the chat about how much do those parameters go up in general with pain?
Yeah, good question. That's a great question. So if they have a viral infection, I've seen temperatures in horses to 104, 105. Horses with strangles get fevers, so 102, 103. So anything above 1015 we consider to be abnormal. Now, this can't be a horse in July that's been standing out in the sun, right? You need to bring him in, let him cool down. Heart rate normally is 28 to 48. If you're riding and exercising your horse, their heart rate can actually go up to 200. It can go, that's for a racehorse, but well into the hundreds for a horse that's exercising. So if your horse is at rest, not exercising, but you think they're in pain and they have colic, then a heart rate of 60 or 70 is pretty important. And then respiratory rate goes up to probably around double this if they're overheated, if they're almost kind of panting, or if they're sick. The other part, so knowing your horse is normal is the step one. So maybe your horse is having something's going wrong, you decide that it's abnormal, you take his vitals, you do a physical exam, and you think, okay, we need some help here. My horse is not well. having a plan on what to do before that day is really important, because you're already going to be stressed about your horse and his health and you want him to be okay. And calling and trying to arrange a trailer is going to be kind of hard. So make sure you have some sort of plan if you know that you would take your horse to the hospital. Now, some people say, my horse isn't going to go to the hospital. The vet comes out to the farm, and everything that happens is going to happen on the farm, and that's fine. But have that plan ahead of time and communicate that with your veterinarian who comes out to the farm, so they know that they're responsible for everything that's going to happen is going to be on the farm. If you think your horse might go to the hospital, if he got really sick and needed extra care or needed surgery, then make sure that you either have a trailer and have it in good working order. So that means make sure it works, make sure the lights work, make sure the brakes work. Or if you're like me, I didn't have a horsey family growing up and we couldn't afford a horse trailer. And so we didn't have our own barn. Our horses were at a local boarding stable. But we had a couple good friends who had horses at the barn and had trailers at the barn. And so we had talked to them about, if an emergency happens, could you be available to help us get our horse somewhere if it needs to go? Now, I lived 4 hours from a hospital, so that wasn't really an option to do in the middle of the night. But there was an instance when I was in high school, my horse got EPM, because we had that in Oregon too, just like we do in Florida. And she needed to go to the vet school. And that family that had a trailer, we worked out an agreement and they were able to take my horse in for me. So you want to have that stuff worked out in the beginning. And then having important phone numbers, like how to get a hold of your vet. If your horse has insurance, what's the insurance policy information? And then your financial plan. What are your limits? What's your budget for an emergency in your horse? And even though it sounds like it's a hard conversation to have, and it is, deciding what your limit is when it's not an emergency is so much smarter and so much easier than trying to decide in the middle of the night when you're sad and you're worried and you're panicked, because you might make a financial decision out of emotion that's actually not in line with what your financial picture is in the rest of your life. So having those guidelines is part of owning a horse, and it's really, really important. The other thing I wanted to share from the veterinary point of view, we see horses and people from all walks of life. And we have horses that come in that have no limit on budget and can get any treatment ever. And then we have horses that come in that really, it's really a financial stretch to even come to the hospital for a basic consult. And that is okay. And so the best thing that owners can do, that I always ask, is if they can tell me as the veterinarian what they can pay for and what they are willing to do financially for their horse, because then me as a vet, I can say, okay, great, I'll make a plan within your limits that fits your budget. The same as if you go to the grocery store or Target or any store, everybody goes in with a bit of a budget. And so if you treat your veterinarian like that, then I can say, okay, great, I can do this and this and this within your budget. And then everybody, it's better for everybody, including your horse. Don't be afraid to be upfront about that. Okay. Having some first aid supplies on the farm is a good idea. That's a good way to be prepared. And the easiest thing to do is to have these supplies in like a tackle box or in a Tupperware, so things stay clean, they don't get dusty, they don't get humid and gross in the summertime here in Florida. But this is where you can keep your thermometer and that stethoscope that you get at the local Walgreens, gloves, some basic bandaging material. Some places will have medications like bute or Banamine. You may have heard of those meds. Those are pretty common. Those could go in your first aid as well. And if your horse colics, what do? Well, don't panic. Take away all the feed, but I generally say don't take away the water because they might be dehydrated. Listen to the heart rate, look at the gums, and then call your veterinarian, right? And so let the vet know what's going on. The vet may recommend a dose of Banamine if you have it or if your farm has it. Or they may say, you know, just let's take the horse for a walk, usually 30 to 45 minutes, not hours and hours and hours. It always makes me sad when a horse comes into the hospital and the owner says, I've been walking this horse for 24 hours, because they're tired, the horse is totally exhausted. And I can tell you it didn't help. And so take the horse for a quick walk, monitor for manure production, and then talk to your vet about whether they want to come out and check the horse right away or whether they want to wait and see how it goes.
So we did have a question, 2 questions
Yeah.
came in. One was, are 2 vets needed for surgery? And then also, what happens during a colic surgery?
Oh, that's a good question. So I don't think I have any pictures here of colic surgery, but multiple vets are needed for colic surgery. So one veterinarian is the anesthesiologist. So they're the ones that are in charge of getting your horse into a sleep state, so general anesthesia. And the horse will be laid on an operating table, a big padded table on their back. So their belly and their legs are pointed up towards the ceiling. And the anesthesiologist keeps your horse totally asleep, same as you would be for a surgery, the whole time. So they don't have any idea that anything is going on, and they feel no pain during the surgery, which is good. Then there's usually a head surgeon, and they're the ones that do most of the surgery. And then they will have an assistant, and that is also a veterinarian. And both of them will do what we call scrubbing in. And so that's where you put your surgical mask, gown, you've got your gloves. When you see all the guys in, all the veterinarians in all of their surgical gear all covered up, that is so they don't introduce any germs into the surgical field. So they are totally sterile, no bacteria whatsoever. And they are the ones that perform the surgery. There's usually also a surgical nurse. So a nurse that comes in that is in charge of opening instrument packs, getting things from the OR, because the surgeons, because they're sterile, can't turn around and touch anything that's not sterile. And so that's the minimum, would be 4 people, but in reality, there's usually probably closer to 6 or 7 involved in a colic surgery. Then that same team needs to be there when the horse is done with surgery and they go into a recovery stall, which is usually a padded stall for safety. They are there to help the horse wake up and then stand up safely. Okay, I think, Kelsey, how are we doing for time?
We typically try to end around 7:30, so you're coming up to your end.
How about we do one more, and then I'll answer any questions that anybody has. How's that sound?
Sounds good.
Okay, this one's really fun. You guys are gonna like this. True or false? Your horse knows when you're cranky. What do you think?
We have
True.
True, it's true. And this is really neat. And I don't know if it'll play. Let me see if it'll play from here. If not, I actually pulled this up online just to be prepared. Oops, let's see. Hold on. I am going to, oh, I think it is. Kelsey, feel free to tell me if this comes through in bits and pieces, because then we'll go to the online version.
Okay.
Special bonds between humans and horses has been well documented. Some would say we even share certain expressions, while now new research shows horses really can read human emotions. In an experiment using photographs of male human faces, scientists discovered horses can distinguish between angry and happy faces and react accordingly. These riders at Ebony Horse Club in London say there is a special relationship between humans and horses.
So if you're happy and relaxed, then they'll be relaxed and they'll just help you. Sometimes I think they just know when you're not having a great day. They can make you feel much better. Obviously they'll react if you are behaving around them in quite an angry manner. They normally react to that. So they do definitely make you aware of your own emotions and how you behave.
Sue Collins from the centre isn't surprised by the findings.
We see kids coming here in very stressful situations they can be in, and we know that if they're calm, and they know that if they're calm, the horse will respond well to them.
The horses were also fitted with heart monitors, which revealed that angry faces caused their heart rates to rise significantly.
Isn't that cool? That's like my favorite thing. So that group has continued to do more work and more research since that was put out. And so, yeah, your horse knows if you're in a bad mood, believe it or not. Okay, guys, that's all I have for now. And when we meet next month, you guys can decide with Miss Kelsey if you want to do more myths or if you want to do maybe a little tour of the vet school. But any questions?
Yes, I have a quick question.
Yeah.
So my aspiration is to become a veterinarian, large animal vet, and shadowed my local veterinarians. I have shadowed quite a few actually. What are some other things that you would recommend that I should pursue in helping me not only with my resume for getting into a college or just in general to broaden my knowledge of veterinary medicine?
Yeah, that's a great question. Well, certainly shadowing is important, and log your hours and describe and make sure to keep a journal of the experiences that you have with that veterinarian, because those are things you can write about in your entrance essays to vet school that can be really important. And then the other thing is to have some volunteer hours, and probably one of the easiest and most fun places to volunteer for people who want to be veterinarians are the local animal shelters. They have them in all counties. They always need help. And I did that in vet school, and it helped not only my resume for undergrad, because they really like to see volunteer hours, but it also helped as it double dipped as a vet experience or an animal experience on my application for vet school. And you know, some days I would just go in and you end up just cleaning cages all day, but then some days I got to walk the dogs, and so, or play with the kitties in the playroom. And so there was a real range of what you got to do. If you want to do horse experience, which of course everybody would prefer probably in this group, look for any local equine therapy groups or equine rescue organizations. Those are nonprofits. And you can volunteer to go in and help them clean stalls, feed horses. That can also be categorized as volunteer hours.
Thank you so much for coming and doing this. Well, not coming, but doing this presentation, taking the time.
Yeah, you're welcome.
We did have an interesting question in the chat from Katie. She asked, what happens when you put the horse on anesthesia? Like, how do you get them to flip over in the bed and maneuver them once they're out?
With big machines, because they are big. So we give them a sedation medication that basically makes them lie down, and we help them lie down by sort of holding them up against a padded wall. So they just kind of slide down and then roll over onto their side. And then from there, we actually put like lifting equipment around their legs and then lift them with a huge 2,000-pound crane lifter up onto the operating table. So it takes a lot of people. And then once they are on the operating table, that table has wheels. And so we can wheel them around as needed.
So I actually have a question.
Yeah.
So for our previous virtual hippology that we've done as a group, not with this group, but in a previous year, I made a bunch of worksheets and PowerPoints about first aid. And I know a lot of our members were asking about first aid. Would you be willing to review those? And then that way we can just upload them on the website and we can talk some first aid stuff at another meeting. Okay.
Yeah, I'd be happy to.
Yeah, because I know a lot of people ask the what do I do if? So those are.
Yeah. No, I'd be happy to review them. And if, you know, maybe if it's okay with you guys, I'd be happy to give credit. I'd love to put them on the extension website for other horse owners to have and benefit from. We're always looking for good resources.
Absolutely. And I know they are interested in doing a behind the scenes tour. I think we had Miss Carissa coming on next meeting as well. So we might be able to do some combination effects.
Okay.
But yeah, so it looks like it's overwhelmingly they want a vet school tour.
It's really fun. There isn't as much going on at, at night as there is in the daytime, but I'm sure we can figure, it's springtime, it's busy. There'll be plenty of going on probably still. And if it's a slow week, we can arrange for a teaching horse and maybe do a demo or something of a scope or something fun. Like I said, I know I had told Morgan I would do, or Ms. Manda, that I would do 2 different dates, and then somehow it got kind of confusing. So just let me know. So I put it on my calendar and I'll make it happen.
Absolutely.
Do we get to see the animals on the tour?
Yeah.
And I have some of the echoes and stuff from one of my local members that recently went to UF for cardio workup.
Oh
so
yeah,
we'll be
Rio.
able to pull him in. Yeah.
Absolutely. Yep. Great. And if that he was a great case. If you guys want to look at some of those images, if you bring the images, I'm happy to talk you through it.
I definitely know our more vet oriented members would be interested in that stuff.
Cardio is fun.
Okay, well, I think we're running close on time. Thank you so much for coming out and chatting with us.
Thank you for having me.
So we have, I'll give it open if anyone wants to unmute and ask any last minute questions. Otherwise, I know everyone's starving and ready for dinner.
Bye guys. I'll see you next time.
Thank you, Dr. DeNotta.
Yes.
All right, and for all the members still on, I am going to be sending a big email with all of the follow-up recordings and worksheets and everything. So please check your email and check the website for all the postings and everything you'll need for next meeting. And if you're interested in doing the happy birthday to baby Ty or the congratulations to Miss Amanda, just send me your slide by next meeting and we'll get that over to her. All right, with that, you guys are awesome. My teens, if you want to stay on just like a whole 3 more minutes, will be good. Other than that, we'll move forward.
Thank you.
Thank you, Natalia.